Hello, everyone. Welcome to my show. Autumn is here. I am your host, Francine Crawford, and we have a special guest today. We have Miss Lisa Brownlee Johnson, and she is the founder of Wisdom Watch Alliance. And we want to welcome her here today. We're going to talk a lot about Alzheimer's. So please welcome her to the show. Lisa, welcome to the show.
Thank you, and so glad to be here. This is such an important mission,
Mhm.
and I am really honored to be able to talk about Wisdom Watch Alliance. We are a grassroots organization founded by three friends, three colleagues, myself, another clinician by the name of Regina Foster, and one of our community ministers, Dr. Stephen Towns. And we really are a community rooted grassroots organization. And we exist because caregivers and communities deserve earlier clarity
Mhm. Yes.
and dignity and support when it comes to recognizing Alzheimer's and other forms of dementia. Because as we know, Alzheimer's is the most well known type of dementia, but there are so many others,
Right.
and particularly impacting the African American community. So, there's a disproportionate impact. We decided to come together to do something
Okay.
that was rooted in the community.
Wow. Okay. How long? How long have you had um, the Wisdom Watch
Mhm.
Alliance? How long?
We really are just getting started. And so about a year ago, as I was uh, fortunate enough to be in this sort of interdisciplinary professional development program at Virginia Commonwealth University, my alma mater. Dr. Towns and I were cohorts in a scholars program where each of us had a goal of developing a capstone project, an initiative. And our capstones were a little bit different from what we're actually doing, but we sort of found some connection in some of the things that were that we were passionate about. And at the time, I was a primary care provider, had been a primary care provider for almost 10 years in geriatrics, and had been recognizing that I was seeing new patients, seeing people bringing family members in who were dealing with cognitive changes and not quite sure what to do, what were the steps. And all they knew was I need to go to find a primary care provider that does geriatrics. These individuals were waiting months,
Wow.
months and months, because as you know, there is, some shortage in primary care access for many people. And so in that seat, in a traditional primary care clinic that did specialize in elders, I was recognizing that people were learning about what to do later than would be best.
Right.
And so Dr. Towns and I sort of got together and said, hey, what do you think about trying to make a way to bring screenings to community settings? And
Mm.
that's sort of where it started. I asked him, I said, can I do a screening on you so you could see what it is that I'm talking about? And he allowed me to do that on the front pew of his church. And as they say, the rest is history. And so that's kind of how we started. I
Mhm.
also had a colleague in Regina Foster who I little did I know she had been a physician assistant or physician associate, also we call them PA,
Uh-huh.
in a specialty clinic at VCU. And we shared patients. I as a primary care provider, and she as a urology specialist. And during the years that we both were working in our respective clinics, I did not know that she was also a gerontologist.
Oh, okay.
And so once I figured that out, I said, let's definitely get together and figure out what we can do um, in a space that seemed to be in a gap. because we have these systems, um, and we have people who are out in the community who are not connected for
Right.
multiple reasons.
Right.
And the sooner that we become, the sooner we're able to gain some clarity on what's happening,
Mm.
the outcomes can be different. The preparation can be better. The support system can be better informed, so
Absolutely.
that there is less possibility of crisis and less possibility of trauma. So that's sort of how we got our start.
So it's
Um,
you do cognitive screening. And it's interesting that
yes, we do. Yep.
it's interesting that you said that. I'm just want to take you back for a minute. You said that you did it on the pew, like
Yeah,
the first one you
in
did.
the church.
So
Yeah.
in the church. Now in my experience with Alzheimer's and doctors and things like that, sometimes when you go to the doctor, they don't order it, they don't say it, they don't. It's not a regular testing or anything like that. So if it's so easy that you could do it right there on the spot, like why wouldn't it be part of a regular exam if it's that easy that you can do it right there?
One of the reasons I think that we have that delay and sometimes that omission is because it does take time to have a conversation. It does. It's the way that our current medical system is built on productivity and volume and metrics. It doesn't lend itself to the sort of depth and sensitivity.
Can you explain a little bit of about the screening, the cognitive screening, like what actually takes place?
So there are multiple screening tools that are out there.
Mhm.
And one of the things that we have done with Wisdom Watch is we have made a conscious decision to select one tool. I say that with wanting to add some context, which is that none of the tools is perfect.
Okay.
And there is, as we know, bias in some of the ways that we measure
Wow.
tools and data and all of that in the health profession. So what we did was we decided, let's use this tool, which is the Montreal Cognitive Assessment, but let's also make our community members and our clinicians aware of a range of tools, because there can be reasons and circumstances to use different tools. For example, the Montreal Cognitive Assessment is considered more of it's more accepted in sort of diagnostic circles, right? And keep in mind, I say that as a clinician, I am a nurse practitioner. So I use that tool all the time in work. There are other screenings that can be done that are not used in that diagnostic setting. For example, there's something called the AD8, which is an 8-question, an 8-item questionnaire that can be completed by the individual who may be experiencing cognitive changes, or more often by an informant, a person that knows that person, a family member. Um, and so just literally using a tool that requires an informant is in and of itself a different, it carries with it sort of different consequences.
Okay.
In other words, if you have to have an informant to get the tool, do you end up being screened?
Mm.
If the results of that tool that you use end up being just kind of sitting and not being used by the clinician in the ecosystem, then is that tool really serving a purpose?
Uh,
And so that, again, that's just two examples of tools. The other tool that comes to mind is something called the SAGE tool, which is a self-assessment tool. There may be people out there who prefer to self-assess and then take their findings to their clinician. if
Wow.
they have that clinician relationship.
Mhm.
So that's, it isn't one size fits all.
Mhm.
Another tool that comes to mind is there are digital screeners that people can download. The Montreal Cognitive Assessment, which I mentioned earlier, has a digital version. And so what we're doing with Wisdom Watch is we want to open the discussion and the pathway for whatever tools are most appropriate
Okay.
for that individual situation, while offering a tool that we can apply as clinicians, as volunteers, with information about what you do. Like, once you have this information, what do you do with it?
Right. You have to
Um,
educate the public and let them know that these things are available. I can tell you, I did not know these things were available at all
right.
when my mom had Alzheimer's. So it's good to know that these things are available, and screening is so important. So can you tell us some of the benefits of early screening? Like, how does that how important is that? Because sometimes you have to kind of put it out there so people can
Well,
realize this is really important to do.
yeah. Um, One of the biggest benefits I would say is clarity, knowing where you stand,
Okay.
and what you can do with clear information. Um, uh, the other benefit I would say is that you have a baseline. That is something that sometimes we take for granted, that our baseline is we're fine, but it's not documented in a way where you can sort of compare. The other thing is screening is a conversation starter. It is not the end, right? It is a gateway to recognizing opportunities, opportunities for brain health, opportunities for things that support independence, relationships, because one of the drivers of cognitive impairment is social isolation. And when we don't talk and there are changes, um, there can be sort of a culture of silence, as opposed to a culture of embracing one another and saying, I'm here for you,
Mhm.
and I see you, and we're going to walk this journey together. So those are the kinds of opening dialogues that having a screening can lead to.
Good.
So this isn't at all sort of an endpoint. It also is not intended to label a person. It really is intended to open doors. And so that's why, with the approach that Wisdom Watch Alliance is taking, we are very, very committed to being community rooted. So that history, and experience with major health systems, but our lane is really like being a steward of the community that we serve, so that this vulnerable space and the information that comes from it serves the community.
So we're talking about, getting more information to the African American community, and what are the disparities that you see as you're doing this, that as far as education or information or access to things. Can you tell me a little bit about some of the disparities between the African American community and other communities?
So I want to be careful not to do sort of,
Statistics and stuff.
comparisons of us and them.
Okay.
But one of the things we do know is that the presence of dementia is more prevalent in African Americans.
Mhm.
And the timing of diagnosis tends to be later.
Mhm.
And what that means is that there is a limitation on access to some of the newer treatments that are coming out. For example, there are treatments specifically for Alzheimer's. That are a type of treatment that you have to have verified plaque formation, and that requires some testing. that is beyond, beyond the screening phase. Um, and it also requires things like MRIs, so higher level diagnostic tools. But you cannot be a candidate for those newer treatments, those specific Alzheimer's treatments, unless you're early onset.
Uh,
Well, if you don't get even a screening until you're progressed, then you don't even stand a chance at getting the treatment. And so we can't solve all of that. But from our standpoint with Wisdom Watch, what we're trying to do is make a difference in the initial screening piece so that people become better informed about the big picture.
okay.
There are other like non-medical factors as well, because you talk about the importance of, if there is a diagnosis of dementia, having a distinction. So there, because there are different types there, and depending on which type, the progression may be different. The impact in terms of symptoms and function may be different. So the sooner that you have a full and clear understanding of what's happening, um, with the actual diagnosis, the better equipped you are to adapt. To put the pieces in place so you don't end up in crisis.
Well, that's great information, especially for, our older adults and things like that. Let me know. Let's talk about caregivers, like
Hmm.
things to they should do or watch out for, or how do they, assess the person that they're caring for, that they know that, okay, maybe you should take a test, or these things are happening. What should they look out for?
Sure. That's a great question. And I think as a caregiver, which I also am a caregiver, this is part, my personal journey, it inspires this work, as well as legacy caregivers who I've learned so much from, is that your loved one better than anyone who may see them in a very short encounter. And so acting upon or recognizing pattern changes, that pattern recognition that no one else will have, does matter, right? And so, how do we turn that pattern recognition into putting our loved one um, into a state of of angst, And so, I think encouraging um, screening is one way to do it. Um, but without pushing, because I think a lot of people um, who may feel very vulnerable when it comes to talking about their brain health and their cognition, and so finding non-judgmental ways into that conversation and offering reassurance and offering to be there with your loved one, so that the goal is partnership and protection and mutual respect, as opposed to, I think there's something wrong with you, we need to fix you.
Yeah.
It's a learning opportunity, and a way to support one another's well-being.
Mhm.
So that would be my best approach.
Approach it.
I don't think there's any one way,
Right.
but if you think about how would I feel if someone came to me and said, "Hey, I think you need XYZ," might maybe feel a little defensive.
Right. Right.
And so, how do you start a conversation out of concern, but with compassion and empathy?
Okay. So,
Also, too, knowing who your resources are.
mhm.
I have found, as an adult um, daughter of parents who are, they're baby boomers. My dad just had his 80th birthday.
Oh, bless.
There is a transition that happens, that can be challenging to navigate when you start saying, but you do have to find a way to do those things so that you can be present and informed about your loved one and the support system around your loved one. Because I know there's a certain culture of, you go into your doctor's office and it's private, and you come out and, you know, how did it go? Oh, it went fine. And that's what you hear, but that's not really detail.
Right.
And so data really, I call it, I think it's data, just clarity of data, clarity of the facts without, um, with, without thinking the worst.
Okay. 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 So, um, I believe you had a summit, with-
Yeah.
right?
Yeah.
Wisdom Watch Alliance had a summit. But tell us about that. Tell us how did that go?
Oh, I am just completely stoked about how that went. And so, what we did was we decided to bring together a collection of folks from various backgrounds as we are embarking on this process of making screenings available, something that really, isn't widely available at all, um, to ask within the framework of respect, privacy, doing no harm. Um, how should we do this? What should be the priorities? And so there was some. We had clinicians, we had students, we had caregivers, and other community members just get into a room and basically brainstorm and have dialogue as to what were the major priorities. 5, 10 crowdsourcing, where everyone at the end of the rounds of dialogue placed their number one biggest idea on a card, on an index card, and we just traded them off, and each uh, idea was given a score, and those ideas that got the highest scores, we were able to tell. And so that from that we have essentially gotten the voice of the community. There were about 40 people there that day. And so it was a good cross section. And some of the themes um, that I will share with you, because we really, it wasn't really about data, it really was about hearing people's lived experiences, um, and major thoughts, that dignity was very important, dignity. And we don't want to be dismissed.
Right.
We want to be seen and heard and valued. We want to be able to be in culturally safe spaces. Um, and we want to understand what's happening before a crisis. So those were some of the major themes, and then to be able to connect um, community-based screening with trust building before there's urgency. So you can't just be like, okay, we'll show up and that's it.
Right.
You know,
Okay.
we will show up and we're in this together.
Mhm. Mhm.
And again, not positioning Wisdom Watch as a solver of all problems,
Right.
but as a grassroots organization that helps to support clarity and action.
Okay. Okay. Awesome.
Yeah.
Awesome. Well, you're based
So
in
I'm excited. Yeah, I'm based in Richmond, Virginia.
Richmond, Virginia. Okay.
Yeah.
So it was you're dealing with that community first. Am I correct?
Yes. So we're doing this locally first because we are doing our screenings in person, with um, uh, community partners. For example, we've had a couple of events where we've offered screenings at local churches.
Mhm.
And we're working on a pilot now where we're going to be screening at one of our local adult day programs. Just, for a couple of hours on a Saturday, um, with a cadence so that people will begin to know, okay, here's a place that we can go for community screening. We are in the process of 501(c)(3) formation so that we can be able to have a sustainable rhythm for community-based screenings. And so this is not to replace um, what has already been built, but to really serve as a connector, because not everyone is, able to get in with a specialist. Not everyone is, able to navigate the health system. And so we want to help to contextualize in a way that, again, reduces stigma. We do know, our focus is on the African American community, although we want everyone
So
involved.
yeah.
But we do know that there is historical mistrust,
Mhm.
and that there's a sensibility about that with Wisdom Watch. And when I say that, I mean there are reasons for that distance. In some cases, a matter, literally a matter of survival.
Right.
And so that is a cultural lens that matters.
Mhm.
And so sometimes when you don't acknowledge the cultural lens and really approach things from a trauma informed perspective, then the trust is not built.
Let me ask you a question because, and as you're talking about that, I'm thinking about. I wanted to ask you, when you have these forums where you're open and you're going to have these screenings and stuff like that. Do you find that people are willing or reluctant or just not informed? Are they, you know, they want to
I
take a
would
test,
say,
or they're excited that, I'm glad that's here, or what are you doing? Or no, I'm not, I don't know much about this, so they're reluctant to do it. What do you?
what I have found is that um, it is a mix.
Okay.
And many people first, as you asked when we started our conversation, well, what is it really? That's part of it. It's not knowing what it is, And so it may take more than one conversation, and that's okay. Which is one part of the reason why we have this goal of making it um, having a rhythm, so that people who may not feel comfortable that day know that will still be there, next month. Um, what I have found often, there is not a huge rush, right? Because I think about, like, who wants to do a cognitive screening, right? Who wants to go to the dentist? There's not this huge people banging down our doors with a high quality and very respectful experience. Then what comes after that is what the real reward is, which is I've had people who've participated in our screenings who've said things like, "Hey, I was able to sit down and talk to my family. I'm so glad I did that." Or, I was concerned, and so I made an appointment with my primary care doctor. So that's the kinds of feedback that I'm hoping that we will be able to um, sustain and scale, to make more available. Because again, it is not about labeling, it's not about closing a door, it's about opening doors, opening conversations, and really building capacity for dealing with what is, we call it a crisis, which, it I almost um, want to stop myself from using that word, because it is a situation, right? And we can learn where we stand, and then develop skills and journey forth.
Okay. Awesome. Well, let me, as we're talking about that, let me ask you one question. Do you have any
Mhm.
follow up? Like when you do the screenings, is there any follow up? Do you
Good,
take your
good
information?
question. So as it stands, what we do is make that optional, and because again, we want to work in a space that preserves um, people's level of comfort. And so, what we have done in the past, and I think we'll do in the future, is offer an opportunity for an individual who is screened to receive a call from us.
Okay. Okay.
But that's purely optional. Intrude. We don't want to intrude. But the the screenings themselves are confidential.
Mhm.
And so I have made it a big point that we give individuals their screening results in a sealed envelope that they can take with them. We are not keeping a database or anything like that, so that we can honor the privacy of those who engage. Um, that said, I think it's very important that we also make clear who is doing the screenings so that there is a way to circle back if so desired.
Okay. Okay.
But we do not want to put anyone in a position of feeling like their information or their privacy is being, um, neglected or, yeah.
Okay. Yeah, I understand that you have to build the trust,
Mm-hmm.
and they have to be comfortable.
Mm-hmm.
You definitely want them to, at least if they get results that is necessary for them to follow up or go to their doctor, you want that to happen. So they have to feel comfortable in doing it.
Yeah.
I know some of the reasons from the past of being taking clinical trials and things like that, that we are not that comfortable with that, but it is necessary to be involved with that. So when the results come out, we're a part of whatever treatment or medicines that they're coming up with. So do you have any information about any kind of clinical trials that might be interesting or might be something that people know that we are doing, that it is happening? Because a lot of times we just don't know about the clinical trials.
Sure. I have a couple of study resources that I would like to share. One, of course, the Alzheimer's Association is the foremost research organization, which I believe, if I could, I'm going to see if I can share that. Um,
There you go.
and so that website,
Okay. Trial match.
yeah, if you Google Alzheimer's Association and trial match,
Mhm.
this is where individuals can find various clinical trials that may match their interest. And so that's one of the places that I think is I trust the Alzheimer's Association in terms of gathering research. The other that I think is especially exciting is called the BA UMAP. And let me see if I can take you there. And I think I'm no longer sharing. Um,
You're still on the screen. It's still
okay. So this BA UMAP study is a large study out of North Carolina A&T.
wow.
And it is really for African Americans and people that have not, who do not have a diagnosis.
Mm.
Was that what that was in there?
And then
It was on the computer.
Yeah.
there is some compensation for this study as well.
Okay.
And it really is a study to look at really what's happening in the Black community.
Okay.
And it is seated at an HBCU as well. And so some of um, uh, the stigma surrounding being study participants, they are very
That's great.
sensitive to. And so this is one, and the goal is to learn more about specifically how dementia and other, Alzheimer's and other dementias affect the African American community.
Okay. That's great.
Yeah,
Thank you. Thank you for sharing.
you're very welcome. Yep.
Is there anything else that you would like to share or talk um, about your Wisdom Watch Alliance, or about Alzheimer's or caregivers that you want to share with the audience?
So I feel like this is such a journey, and for me, it has evolved
Mm,
because again, I became aware of Alzheimer's and other forms of dementia as a clinician,
mm,
um, and so I think my awareness came probably a little bit over 10 years ago or around that time. And I say that to say that was when I had my clinician cap on.
Okay.
But in retrospect, I think about the lifelong relationships that I have with people who have been on this journey as caregivers, people that I, went to college with, people who I've known for 35 years, whose wisdom in this journey is just irreplaceable. And I now, as a clinician, that's probably my secondary role. I'm a caregiver. I have a dad who was recently diagnosed with vascular dementia and possible Lewy body. And we're also dealing with other cases in our family. And none of the clinical training really prepares you for the walk of being a caregiver. And so I am grateful to have this conversation with you, Francine, you, Shani, as well. And this is part of this sort of purposeful, really this purposeful walk to help one another. And so that's kind of where I would leave it. Let's keep talking.
Yes.
Because we're going to change some things based on what people who've gone before us have gone through. So I say that with great humility and sincere gratitude.
Uh-huh. Well, thank you. I think that, you're absolutely right. It's so many things that as I'm going along and I'm learning also that it's so many avenues that this thing branches out to. And people are working on it and people are trying to get information and education and to whomever is dealing with this as far as caregivers and for our seniors to try to be proactive in their care and screening and things like that. So it just seems like it's so big, but if you don't start talking about it, if you don't start sharing, if you don't start coming together, it'll just stay there and it get worse. And we need now as much as ever to have voices out there. I appreciate the Alzheimer's Association and other organizations that do what they do, but you also need some grassroots and some people, down in the community, in the neighborhoods, in the churches, just talking about this, talking about dementia, talking about caregiving, talking about aging process and what's going on and things that we need to be aware of. So thank you for what you do with Wisdom Watch. And I really appreciate that. It sounds great. And I'm very excited that you actually taking screenings. Like, people need this. People really need this. And just to kind of get people familiar with this, it's okay. Let's see where you're at. We need to know where we're at. Like you said, you need a baseline. So later, things change. You'll have a baseline.
Well, thank you as well.
Yeah.
And
it's very important. So thank you so much for taking the time out to interview with us on Autumn is Here. I really appreciate it. And I wish you the best. And just keep me informed.
Absolutely. Absolutely.
Yeah.
All right.
All right.
Take care.
Thank you. Bye-bye.
Bye-bye.